Hello, and Happy New Year, everyone. Welcome to 2022. A lot has happened in the Ohio behavioral health space since our last update. My name is Ray D'Alessandro from eTactics, and I'll provide some important updates. Many of these updates impact the business flow and processes that help your agency get paid for the critical services that you perform. Our first important update is that the HHS has extended the federal public health emergency for another 90 days. So effective January 16th, the U.S. Department of Health and Human Services provided another 90-day extension of the national public health emergency related to COVID-19. The extension will allow pandemic-related accommodations, federal rule relaxations, and enhanced Medicaid match to continue until at least April 16, 2022. The PHE has been in place since early 2020. Now, the Biden administration has committed to giving states a 60 days notice before the PHE will expire for good. States will know by mid-February whether another extension will take place after April. Given the ongoing impact of the Omicron variant, most experts predict that the PHE will be re-extended for another 90-day period when the current declaration expires in April, but agencies should keep a lookout for the next announcement. And while this next associated topic will not impact agencies immediately, it will be a cause for possible disruptions once the PHE does officially end. As a condition of receiving enhanced federal funds during the COVID-19 public health emergency, states were required to take certain steps to ensure continuous Medicaid and CHIP coverage for most enrollees. This led to an overall 18% jump in Medicaid enrollment. But with the latest PHE extension set to expire after April 16, states will no longer receive such funds and will therefore no longer be required to maintain continuous coverage, although the CMS has given them 12 months after the month in which the PHE ends to complete eligibility redeterminations. As a result, supporting states' re-verification efforts and ensuring that eligible members stay on their rolls or have a viable landing spot will be critical to Medicaid managed care organizations sometime this year or into early 2023. Now stay tuned to this upcoming avalanche of possible uncovered members once redetermination is required. But there's more fun, because here in Ohio, we'll have its own immediate challenge when the next Ohio Medicaid open enrollment takes place in the spring of 22 for all Ohio Medicaid members, as the new MCEs are introduced into the next phase of the Ohio Medicaid Next Generation coverage set to take effect on July 1st of this year. All members must re-enroll and select an MCE even if they plan to stay with the same one. You might imagine the challenge that this might present. We highly recommend that all agencies and providers have a well-defined and efficient process for checking and validating eligibility insurance verification, as there could be much churning of Ohio Medicaid members with the new plans coming on, Paramount going away and possibly being handled by Anthem, and probable confusion as to which MCE has the member under agreement. eTactics has some advanced and efficient tools to facilitate the finding of correct coverage plans. So what should an Ohio agency be doing now, if it's not already happening? While in preparation for the Next Generation program, providers should contact the new plans that they are interested in contracting with to begin the process to join their provider networks. Provider contracting contact information for the Next Generation plans can be found on the Resources for Providers webpage of the Next Generation under the Ohio Medicaid website. Now, contracting must be completed by February 15th, 2022, right around the corner, to be included in the Next Generation provider directory on day one of member transition enrollment. This allows members to have all of the information needed to decide which managed care plan is best for them. No change is being made to the timeline or process for updating the provider directory, and the provider directory will continue to be updated on an ongoing basis. So what should you be advising your current members and communicating to them? Well, the Ohio Department of Medicaid wants to make sure all members receive information about actions that they will need to take and information about the program's next generation services, supports, and managed care plans. In support of this goal, ODM is encouraging Ohio Medicaid members to update their contact information. When an Ohio Medicaid member updates their contact information, it helps to make sure that ODM can reach them to provide important updates about their Ohio Medicaid managed care plan and coverage. Ohio Medicaid members can update their contact information at any time by contacting their County Department of Job and Family Services, ODJFS. An Ohio Medicaid member can locate their ODJFS by visiting the county directory at the JFS website. As your front desk and case management teams interact with members in the coming months, please encourage them to make sure their contact information is up to date. For those agencies looking to communicate via mail with their members, eTactics has capabilities to print and mail informational letters about the upcoming events and requested action steps. So now let's move to the really important stuff, and stuff that most of you have been waiting for. What's going on with the old MIT system and the new fiscal intermediary? Can I still use my existing clearinghouse? How will I be able to test and when? Well, the good news and the answer to many of those questions is that the ODM Next Generation program has started the connectivity and testing process with a select group of current clearinghouses and trading partners. eTactics is one of those approved and current clearinghouses and will be involved in the pilot testing program. Now, once the new program starts on July 1st, eTactics clients and future clients will still be able to send their claims and eligibility requests through eTactics for processing, just as they always have, with little to no changes. And that is very good news. Plans call for end-to-end claims testing with the new and current MCOs. ODM is meeting regularly with all of the MCOs to provide detailed education on behavioral health services, billing, and rates to prepare them for testing. ODM is conducting testing with key trading partners and clearinghouses used by the MCOs as part of the process in order to ensure behavioral health claims adjudicate and pay appropriately. ODM will be working with a small group of behavioral health providers to complete this work in a test environment with existing claims and the 212 test scenarios from the behavioral health carve-in. This testing will also include testing for Ohio RISE. So the thing to know is that the old MIT system is being replaced by the new PNM system, and the new One Front Door process will be part of the OMES program. So get used to hearing PNM and OMES. ODM has also clarified that claims sent to the fiscal intermediary may be done through either a clearinghouse or a trading partner. Now, there are still some questions that are unanswered regarding providers acting as their own trading partner and the steps necessary to directly submit claims to the fiscal intermediary. ODM recently terminated trading partner agreements with a host of behavioral health provider organizations due to claims not being submitted in the last 2 years. FFS claims and crossover claims would be the claims currently submitted directly to ODM. Now, ODM is not currently onboarding any new trading partners as they are working on transitioning systems. Active trading partners such as eTactics will be transitioned to the new system, and we will participate in testing with the fiscal intermediary this spring. Please continue to visit our Ohio Behavioral Health landing page by Googling Ohio Behavioral Health for continued updates as they become available. In other news, the ODM provider enrollment backlog continues. Unfortunately, ODM is currently experiencing an extremely high number of new applications and really are unable to keep up with their current staffing level. There was a backlog of over 750 paraprofessionals they are working on to process as quickly as possible. They have dedicated additional staff to help process the paraprofessional applications, but were unable to share an approximate time frame as of this recording for when they would be able to complete. These are critical processes that have a critical impact on reimbursements and the timing of your reimbursements. eTactics highly recommends that Ohio behavioral health agencies have good tools to quickly identify denials, rejections, and communications that come back from the MCEs with improper or untimely provided base denials and rejections. eTactics has a variety of tools and reporting to help identify these critical non-payment activities. Generally, the recommendation is to hold claims for providers that have not been approved for enrollment yet. eTactics might also have ways to hold those claims from specific providers until they are approved. Some recent examples have CareSource taking 15 to 30 days to recognize new providers added to the group. As a reminder, MCOs have a maximum of 15 days to update their own provider enrollments. If this is not happening, you should escalate within the plan, and if that does not resolve the issue, please file a complaint with ODM. CareSource and Buckeye recently termed providers again at one agency because of the revalidation delay. Fixing them, then they start paying, and then they stop paying again. So very frustrating. Aetna has also had some issues with updating provider files in a timely manner, and they tend to not go back and reprocess any claims that were initially denied for this reason. It's also being reported that Molina, Paramount, and UHC also have some provider enrollment and prior authorization response issues. And finally, some updates on telehealth place of service. CMS updated the list of place of service codes for Medicare, and we understand that most private insurance companies follow this as well, but it will now include a code for telehealth provided in a location other than the client's home, which is 02, and telehealth provided in a patient's home, which is now 10. These new definitions are effective January 1st of this year, however, are not available to use for Medicare until 4/1/2022. As a reminder, Ohio Medicaid is not using POS02 or 10 for telehealth. The GT modifier should be used to indicate a service is performed by telehealth as indicated in the Behavioral Health Manual. Medicare also had some updates on FFS claims payment adjustment changes. The Protecting Medicare and American Farmers from Sequester Cuts Act impacts payments for all Medicare fee-for-service claims. It now includes no payment adjustment through March 31st, 2022, a 1% payment adjustment April 1st to June 30th, 2022, and then a 2% payment adjustment beginning in July. Well, that's a lot, and that's it for now. Lots of information to overload our brains with. Please follow us along with our updates and feel free to reach out to us with any questions that we might be able to help with during these critical changes and transitions to the new Medicaid Next Generation program.